Hi, my name is Jacob Dunkley, and I'm here to talk to you about coronavirus and also the vaccines available for COVID-19. I'm not a doctor. I'm a recent graduate of KSU, Kennesaw State University here in Georgia, and I am pursuing a medical degree. Now, all the information that I have gathered to learn about the virus and also the vaccines, I will provide in the description. Now, this is just a point to inform you about vaccination and what choices you have here in the U.S. So, what is a virus? A virus, by biological definition, is an obligate intracellular parasite. So what that means is that it's kind of like a germ that has to get into your cells to replicate, to survive even. That's why we say it's obligated to do so. SARS-CoV-2 is not the only coronavirus we've seen. We've seen two other ones before. Back in 2002 in China, we had SARS-CoV-1. Now, SARS stands for Severe Acute Respiratory Disease or Syndrome. The other case was in 2012 in the Middle East. It was called MERS, Middle East Respiratory Syndrome. And these viruses are called coronaviruses because they look like a crown. They have spike proteins all around them that give a shape that's kind of like a king's crown. And in Latin, crown is corona. So these vaccines that we have to talk about are based on this spike protein, most of them. Pretty much all of them that are available here in the US are based on using some form of spike protein replicate that'll give you immunity to it so that you won't become infected by the virus. According to the CDC, there are several symptoms of COVID, and they seem like flu-like symptoms. So we have fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and finally, diarrhea. Now, how do you become immune to a virus? Well, you have a natural immune system that hopefully each of us have. Sometimes you can have immune deficiencies and other issues with your immune system, but for the most part, you have two branches to your immune system. You have an innate immune system, which is a local and fast responsive immune system. Then we have the adaptive immune system, which is a slower but global effect kind of immune system. That's the one that generates antibodies, and it takes time to do this, and that gives you long-lasting immunity to any kind of pathogen, whether it's a virus, a bacteria, anything that you've been exposed to that your body sees as foreign, including, unfortunately, allergies. So the vaccination is a method of triggering the adaptive immune system. And there are 11 mechanisms known that scientists use to make vaccines, not just the one that we're used to. The one we're used to is called a whole cell attenuated or whole cell inactivated vaccine, where the virus has been inactivated so that it doesn't infect you, but you still get exposed to it, so you can develop antibodies to the virus without having the risk of getting sick or dying from the virus. So the reason we wouldn't do this with coronavirus or SARS-CoV-2 is because we have concerns about ADE. Now, that is antibody-dependent enhancement, where you producing antibodies to the virus may actually help the virus infect you better and may lead to your death. So this has been evident with past coronaviruses, the ones I mentioned earlier, SARS-CoV-1 and MERS. But recent studies have shown that there is not much concern about ADE for this virus, but this was something that Dr. Fauci actually spoke about a lot in the beginning of discussions about coronavirus vaccines. So before we get into talking about the vaccines we currently have, we need to discuss something about them. They're not FDA approved. What they have is EUA approval, which means that they have emergency use authorization. Now this is completely different from FDA approval, because what FDA approval means is that in terms of whatever risks there may be in the use of a drug or a product, the benefits outweigh them. Now, with an EUA approved drug or vaccine, these ones are the only available resources we have to treat something that's in a pandemic level threat, or if it's something that is new and unknown. So these are subject to change at any given moment by the FDA. They're under supervision by the FDA, and they're not approved. Now, to do this, to receive EUA, you have to have a specific type of test. Now, this kind of test is it's a little bit complex in its wording. It's called a randomized placebo-controlled safety, immunogenicity, and efficacy study. What that basically is, it's a blinded study where the bias of the scientists cannot be used against the data. Unfortunately, we're all biased in some way. If I am making a vaccine and I want it to work, I may have some biases that may play into the data. Now, a placebo is, you've probably heard of the sugar pill. It's the same thing, where instead of giving you an actual vaccine, we're giving you something that is meant to be a control. What would actually happen if you got infected without any resources like a vaccine to help you? Now, there's another thing that we need to talk about. It's called the PrEP Act. The PrEP Act was made effective on the 4th of February 2020. Now, this gives the companies that make the vaccines, Pfizer, Moderna, Johnson & Johnson, a low risk, or it gives them no legal liability with their vaccines. What this has done is it's basically given them some leeway in terms of what they can do with creating vaccines. It's not meant to really challenge you as someone that's gotten a vaccine from them and say, well, I'm sorry if you've gotten an adverse effect and your life has changed. It's really meant to help them feel less burdensome and feel like there's less risk with making a vaccine. Because if they had the risk of legal action, then they would be more cautious and more slow in producing any kind of medication or vaccines to help you. And so there's only one option if you do have any adverse effects or any serious side effects, even death, and that's with wrongful misconduct. But any other forms of ailment or emotional stress that's caused by vaccines produced by these companies, you will not find any legal court to defend you. So, will this vaccine actually prevent me from catching COVID? Well, let's compare it to something like a flu vaccine. Flu vaccines have this range, according to the CDC, of effectivity, where it's 40 to 60%. Now, that might seem low to some of you, but that's a common vaccine that people take yearly. Keep that number in mind, that range in mind, as we discuss the current available vaccines in the US later on. Now, just to preface this, there's something called an adjuvant. Now, an adjuvant is meant to increase your immune response to the vaccine, and what that does is it gives you those adverse effects that you talk about or you hear about, where you have a headache, fatigue, muscle pain, things like that. These are called reactogenicity effects. So what that means is that your immune system is reacting to the vaccine, which is a good thing, because what that means is your immune system is recognizing, hey, this is something that's foreign to my body, it shouldn't be here, I need to mount a defense against it so that I can clear it, and if I ever come across it again, I can clear it quicker, and I can clear it better than I did before. So what that does is it gives you the immunity that a vaccine should give you. Now, the common ones, like I mentioned, are redness, pain, headache, soreness, fever, and swelling. And those are common side effects that you'll find in all of the vaccines that you may have taken in your life. Well, let's get into this discussion about current vaccines in the US. Now, first on our list is Moderna. Now, there have been, in their clinical trial, 30,418 participants. Of the participants, 15,208 were in the vaccinated population and 15,210 were in the placebo population. Now, the mechanism that's used by Moderna and also by Pfizer, we'll get to that one next, is an RNA-based vaccine. And it's done with 2 doses. What the RNA is a transcript for proteins that will essentially manufacture the spike protein that the SARS-CoV-2 virus will use to get into your cells. Now, what will happen is, or what's supposed to happen, is that your immune system will recognize a spike protein as something that is foreign to it, and it will mount a defense to it, it will create antibodies to it, and whenever it sees it, whether it's on an actual SARS-CoV-2 particle or viroid, it will actually recognize it and deactivate it. We're trying to develop neutralizing antibodies to it so that it'll prevent the virus from even getting into your cells and infecting you in the first place. Now, the FDA had some major points in their briefing. I'll discuss them here. So we'll discuss efficacy, meaning how well it worked, and then we'll discuss safety. So in terms of efficacy, we found that 94.5% of the vaccinated population did not get infected when they were exposed to SARS-CoV-2. And this was the population that was never before exposed to SARS-CoV-2. And for the population that had been exposed to it before, there was a 93% efficacy. So it's pretty close range, and it's a pretty high efficacy. Remember that range that we had for the flu vaccine? That was 40 to 60%. Now, the safety, as we discussed earlier, most adverse effects are those that you would find with a typical flu vaccine or any kind of vaccine before, or even flu-like symptoms. It's the same symptoms you would get if you were infected with an actual pathogen. It's just that these are meant to mount a defense to something that's not actually going to infect your cells. And so we found that these were mainly after the second dose of Moderna. Now, Moderna has 2 doses, and they have a 4-week period between them. Now, the soreness at the injection site was the highest of the adverse effects, and it was 90%. There was headaches at 70% and muscle pain at 63%. And that pretty much covers what the FDA was talking about, the major points that we really need to discuss about it here. Next on our list is Pfizer. Now, we have 43,651 participants, 21,828 placebo, 21,823 vaccinated. So this is also an RNA-based vaccine. It also has 2 doses, but this one has 3 weeks instead of 4 weeks between the doses. Its efficacy, actually, they showed the efficacy after 1 dose, which was 75%. And then the second dose was 95% in the non-exposed, the non-pre-exposed population, and 94% in those that were exposed previously to SARS-CoV-2. Now, the safety is similar in terms of Moderna, the same kind of side effects, except they were in lower percentages. There was less of them found. So the injection site was about 84%, headaches were about 63%, and then muscle pain was about 55%. Now, in both the cases of Moderna and Pfizer, there were severe unexpected adverse effects. These were severe effects recorded below 1% of the population of participants, and they were deemed representative of the population. What this means is that these effects would have occurred in any population regardless of the circumstances of being vaccinated or being exposed to SARS-CoV-2. These could be something like appendicitis, which would happen regardless of whether you're being vaccinated or not. Now we get into Johnson & Johnson. Recently, Johnson & Johnson had been pulled. We'll discuss about why it was pulled and why it was brought back, why it was paused and why it was brought back by the FDA. Now for this study, we have 44,325 participants, 22,175 were vaccinated, 22,151 were placebo. This one is different from Moderna and Pfizer in that it's a viral vectored vaccine. What this means is that there's a virus, a harmless virus called adenovirus, which carries in it the RNA required to make spike proteins of SARS-CoV-2, the COVID virus. So what this has done is it's basically made a viral mailman that's delivering the information to your cells to produce the spike protein so that you can become immune to the spike protein, just as Moderna and Pfizer had. And it's a one-shot vaccine. Its efficacy rate is actually much lower than that of Pfizer and Moderna. And it has two different periods of measure from the FDA. It has 76.7% after 2 weeks of being vaccinated, and then 85.4% after 4 weeks of vaccination. So what that time difference really is, it's about your immune system mounting the defense and getting ready to make the antibodies to this spike protein that's being delivered. Now let's get into Johnson & Johnson's safety. The expected side effects were similar to those of Pfizer and Moderna, where we had pain at the injection site, headaches, and fatigue. And let's get into the unexpected ones, because these are the ones we heard about in Colorado with the 6 cases of rare, severe types of blood clots. Now, in the study, they mentioned that they had what they said is thromboembolic events. What this means is they had blood clots, and it was in a population less than 1% of those in the study, but the FDA mentioned in their briefing that they would monitor this. So when these 6 cases occurred, they paused it and reevaluated the vaccine. And what they found is that it actually was representative of the data. So if you have a less than 1% probability of developing blood clots in any population based on this vaccine, then if you take millions of people and you vaccinate them, there's still that less than 1% chance, and that's representative of the population that got vaccinated with Johnson & Johnson. So this is why they reevaluated it and then unpaused the vaccine so that you can still take Johnson & Johnson if that's your choice. Now here's another concern that I came across, and I didn't feel right if I didn't say this to people, because I'm growing up in the South, in Georgia, and I have to say this because I know that this is the Bible Belt. There's a religious concern with this vaccine. The cell line that the adenovirus, the viral mailman that we discussed, is grown in is probably derived from aborted fetuses. The cell line is, if you look it up, said to be derived from cornea cells of fetuses. That is to say, cells of the eye of fetuses. I'll put in the description the exact cell line so you can look this up for yourself, but I just thought that was something to mention. Let's get into a pros and cons list of Pfizer and the rest of the vaccines. So let's start with Moderna, actually. So pros, this is the second highest efficacy of all the vaccines available, and essentially the only con is that it requires 2 shots. For Pfizer, the pros are it's the most effective of all the vaccines. It has slightly lower side effects than Moderna, and also has only 3 weeks between the doses so that you can have the immunity faster than Moderna would. Now for Pfizer, the main pro is that it is a one-shot vaccine, so if you just want to get stuck once, that's it. Now let's discuss the pros and cons of all the vaccines that we've discussed. Now let's start with Moderna. The main pro is that it has the second best efficacy of all the vaccines that we've discussed. Now the con is that it requires 2 shots. I know a lot of people are actually afraid of needles, but if you're afraid of it, then maybe that's a con for you. The next one is Pfizer. Now this major pro is that it has the highest efficacy of all of them, and also it's only 3 weeks instead of 4 weeks to get your second dose, so you can get it out of the way and you can develop your immunity much quicker. And then the third vaccine to mention is Johnson & Johnson. Now this one's pro is that even though it has the least efficacy of all the SARS-CoV-2 vaccines available, it still has a pretty high efficacy. Remember our value for flu vaccines having 40 to 60% efficacy. 85 is still pretty high. The cons for this one are that it is less effective, and there's a potential flaw in the design of this kind of vaccine, because your viral mailman, the adenovirus, you may actually become immune to it before it can even get into your cell and deliver the RNA to make the spike protein for you to become immune to SARS-CoV-2. So that's a major concern. Oh, and of course, for those who are afraid of needles, Johnson & Johnson's other pro is that it's only 1 shot. Now let's discuss the new strains out there. We have 2 new strains to talk about. We have one that's in the UK and we have one that's in South Africa. And unfortunately, these have already come to US soil. They're here and they're infecting people. And so the big concern is, are our vaccines still gonna work? And that is a concern. Actually, in the FDA briefing, they did discuss that there was slightly less efficacy for some of the vaccines, and what this may indicate is that we need a booster shot. And you may be wondering, how did it even get to be a new strain? Well, how vaccines work is that they replicate very quickly, and they make millions upon billions of what we call viroids, which is little particles of the virus, the actual thing that infects you. And so because it makes a lot of it, it actually has more opportunities to mutate, especially if it's an RNA virus like SARS-CoV-2, where it has less proofreading ability, so therefore it creates more point mutations and leads to more serotype changes, which can basically lead to less effective vaccines in the future. But regardless of whether we have new strains in the US, it's key to still get vaccinated if you want to maintain the current strain, the major strain that's in the US, because it doesn't just affect you personally being immune to it, it actually affects the entire healthcare system. If you get vaccinated, you help your own community by building that herd immunity everyone's been discussing in the news. And what that does is it takes the burden off of those doctors and those scientists that are working really hard to maintain this virus and prevent it from taking over and, you know, killing many more people than it could. You are taking your first step in helping the community recover by taking a vaccination, by getting vaccinated. So it's not something to write off. It's an important step in getting over this pandemic. Now, I think there is 2 big misconceptions we need to talk about when it comes to RNA vaccines and RNA in general. The main misconceptions are transfection, and what that is it's essentially introducing nucleic acid into a eukaryotic cell. What that means is that you're introducing a type of compound called nucleic acid. This is the same thing that's what we call DNA and RNA. Those are the two main nucleic acids. DNA, I'm sure you've heard about it. You've heard of Ancestry.com and those other kind of sites that tell you based on your DNA who you are and basically where you come from. It's an identifier. It's also something that basically gives instructions to all of your cells in your body to make things. RNA is the transcript. It's like the recipe for proteins. And so with transfection, there's no chance of it actually sticking into your DNA or somehow getting into your DNA. How it works is this. When you get infected by either the virus or get vaccinated and you have RNA in your body, it doesn't go into the nucleus of your cell, which is where the DNA is housed and protected. It actually stays in the cytoplasm by something called the rough ER. The rough ER is where the kitchen is essentially for the recipe to make the protein. So the recipe stays in the kitchen, in the rough ER, and it is producing the protein through the ribosome, which is the chef, essentially, and it stays there. The protein gets made there, gets packaged, it gets sent where it needs to go. But unless something has an integrase enzyme, which would integrate it into your DNA, or if it has a nuclear locating signal, meaning it has a signal on the protein that says, hey, I am supposed to go into the nucleus, it's not going there. So it won't change your DNA. It won't make you some form of mutant based on having RNA in your body. And on top of that, RNA doesn't stick around. There is an enzyme specifically targeted to break down RNA. It's called RNase. And so on top, and even further, RNA is not very stable. It tends to tear apart. RNA is not stable. It's not something that is very stable and will last long in your body, in your cells at all. So there's no worry about you becoming infected by the virus or this vaccine's spike proteins or RNA and it changing you forever in that capacity, changing your genes. There should be no concern. There's no evidence of that so far, and I'm sure they're monitoring it. Just to be perfectly clear with other concerns that you should know about, besides the fact that you can have severe respiratory issues based on the infection of SARS-CoV-2, there's something called myocardial injuries. Now, what these are about is an imbalance with your oxygen supply in your bloodstream. And so the ACE2 enzyme, this is a specific enzyme that the SARS-CoV-2 virus binds to with that spike protein we've been talking about. It's what it uses to get into the cell. Now, this ACE2 enzyme is not something that was just there for the virus to bind to. It's something that actually gets used. And its purpose is regulating something called renin-angiotensin systems. And these are meant to metabolize certain enzymes and certain compounds so that you have pro-inflammatory and vasoconstriction effects. So basically what it's doing is angiotensin 2 is a pro-inflammatory and vasoconstrictor compound, and the ACE2 enzyme will break it down. So then you have less vasoconstriction and less inflammation in your blood vessels. Now, by using the ACE2 enzyme to get into your cell, it doesn't just keep the ACE2 enzyme on top of the cell where it was or connected to the cell surface, it actually takes it with it inside of the cell. So then your ACE2 enzymes are in a lower concentration on your cells, so therefore you have less of them available to break down angiotensin II. And basically what this does is it creates a positive feedback loop where angiotensin II is in high concentration, and you have inflamed blood vessels which are more permeable than normal ones, meaning that there's more things that can get into your blood vessels. And so this can lead to problems with, if you're infected, you already have things called cytokines and other pro-inflammatory kind of molecules, and even immune cells that are going around, and they can maybe even get into some of those blood vessels and create problems later on. So here are 4 of the problems that we've been finding. There's something called fixed coronary atherosclerosis, which is the formation of plaques in the walls of arteries. There's endothelial dysfunction with coronary microcirculation, which means you have some blockages and some dysfunction that's going on with the cells that make up the circulatory system there. The small circulatory system, so that's like capillaries and things like that. And then you have severe systemic hypertension, raised blood pressure. People have actually developed hypertension from being infected with SARS-CoV-2. And that's a serious concern. That's a lifelong chronic disease. And that's from one virus infecting you. And then the last one is hypoxemia, resulting from acute respiratory distress, which this is what the virus would do. I mean, if you have low oxygen levels and you maintain low oxygen levels for long enough, you can actually develop hypoxemia, and that can be deadly in some cases. Now, the second disease that may be related to SARS-CoV-2, or any syndromes that might be related to SARS-CoV-2, is testicular orchitis. This is something that was actually found with SARS-CoV-1 as well, and it basically, recent studies have shown that they haven't been able to rule out the possibility. Some people have been talking about becoming infertile from SARS-CoV-2 infection, and testicular orchitis is basically inflammation of your testicles, and this can lead to infertility and even testicular atrophy. There'll be more about this in the description if you want to read more about it. Now, as a final reminder, it is your choice whether you want to be vaccinated. No one has to make that choice for you. No one should make that choice for you. You are your own individual. You have your own rights in this country. And you also have to recognize that this does benefit the community. I know that many people talk about the greater good and will push limits, but you also have to remember that you have rights as a citizen of the United States. And according to HIPAA, you're not required to share with anyone, whether it's an employee or your friend or family, whether you've been vaccinated. And the choice is really up to you as a patient, and you should not let any doctor or any scientist make a decision for you. You have to make the decision yourself as a patient, as a human being. Well, this has been very exciting for me. This is the last project I have for my semester as an undergrad. I really hope that this was informative and that you guys learned something from this. If you have any questions or concerns, reach out to me. Thank you very much. Bye-bye.